Welcome to Dr. Deane's Healthcare Webinars, and today we're going to talk about single payer, and specifically, will single payer save us and the United States? That's the question for today. These webinars are brought to you by myself, Deane Waldman. I'm a professor emeritus in pediatrics, pathology, and decision science. I currently serve on the board of the New Mexico Health Insurance Exchange, and I'm the author of the book, The Cancer in the American Healthcare System, which I certainly hope you will consider reading. Current titles in this series include What's Really Happening in Healthcare, Should I Buy Health Insurance or Not? What would a good doctor do? Is the Affordable Care Act the answer? Single payer and other fantastical beings, which is today's topic. We will talk in another webinar about the cure for healthcare, and we also will discuss tort reform and specifically why we don't need it. Today, we're going to ask first the question, what is a single payer? We are going to discuss what the advocates of this approach say it will do. We're going to look at the evidence for single payer systems, because there are such out there now. We're going to ask and answer the question, is this what you really want? And then we'll talk about some steps that you should take in the future. Now, single payer is also synonymous with, or at least people use it synonymously with, universal health care. They talk about it in the same breath as the public option, and effectively it is government control of health care. I found this on the internet and thought I would share it with you. It was a single payer healthcare flowchart, starting with your government, then money, and then that blue arrow and your doctor, and they end it with, any questions? Well, we have some. Firstly, who is the most important person or thing to your governmental representatives in Washington? I think you know the answer to that, but I'll leave that open. Next, whose money is it that is represented by those dollar signs? I really want you to think about what the implications are of this arrow, namely, who controls what and with whom. And finally, ask yourself this question: who does the doctor work for? The answer to that question for basically anybody is whoever pays him. Now, single payer advocates claim a number of things. Let's start with this one. Each person, these are quotes from the Physicians for a National Health Plan website, which is one of the major support groups for a single payer system, which, by the way, that group contains very few actual clinical doctors. But, quote, each person, regardless of the ability to pay, would receive high-quality, comprehensive medical care and free choice of doctors and hospitals, end quote. Okay, ability to pay. Who's paying what? Well, the government taxes you, and then it takes its cut, and what is left over is its ability to pay for your care. High-quality care, well, who decides on the quality of the care you get? Answer, the central government. Comprehensive care, I try not to laugh at this as a physician, because you and I know that as the government is in control, the budget is more important than your health care, and their re-election campaign is a heck of a lot more important than you. And free choice of doctors and hospitals, respectfully, don't make me laugh. The government chooses your panel, and doctors are in it or not, and you don't get to choose what doctor you go to. The government does. Another one is, quote, 95% of people would pay less for health care. The system would save billions and could be redistributive. Well, firstly, 95% would pay less is just flat out doublespeak. The fact is, 100% of people pay nothing directly in a single-payer system, and how much more they pay is a whole nother matter through taxes and through indirect taxes. Save billions. With respect to anybody who wants to advocate this, do you really think that the government is more efficient at doing anything than the private sector is? I defy you to show me one activity in which the government is more efficient than the free market. As for could be redistributive, with respect again, who gave the government the right to redistribute our income? Answer, nobody. Who gets the first and biggest piece from the healthcare spending pie? This is a drawing that I commissioned, and I love and hate it at the same time, because what it really shows is that the government takes what it wants from healthcare spending, and then we, the patients and the providers, get the leftovers or the droppings. Next, single-payer advocates claim, quote, slashing to Canadian levels of administrative spending would save enough to cover the uninsured. Canadian levels of spending? Well, in the province of Alberta, 40% of the total budget for that entire province, which is the size of my home state of New Mexico, 40% of it goes to the healthcare budget, not to the health care of people, but to the healthcare system. Administrative spending, as we all know, the government decides on the spending, and then we get whatever is left over from their spending. As for covering the uninsured, that's again doublespeak, because all citizens are insured, so there are no uninsured, if you will, except an occasional traveler. And the illegals in that country, whether it's Germany or France or Great Britain, all, quote, single payers, end quote, they don't exist. I can speak with direct experience because my son became ill. He's an American citizen in Great Britain and got good care and got presented with a bill, a rather sizable one. And frankly, about 7 years later, he also became ill while he was giving a speech in Paris, and again got good care and a nice sizable bill. Next, single payer is the only plan which features effective cost control measures. I had trouble writing this down without spitting off to the side. Effective control measures. Well, effective means literally government control. Cost does not mean cost, it means spending. And finally, control in that sentence literally means rationing of care. The government effectively controls spending by rationing our care. As for the only plan above, it is true that central, that is government planning, is what they're talking about, but I ask, what about the market? How might the market affect this effective cost control activity? Finally, quote, budgets for capital expenditures would be based on healthcare priorities. Now, I want you to pay a little special attention to that word healthcare, because healthcare is one word, as you know, means the system, and healthcare, two words, means your health care, service, and goods. When they're talking about healthcare priorities, they're talking about the budget is more important and comes first before any of your care needs. So if you think about all of these one after the other, you must conclude the following. A single-payer system does not do what its proponents think that it does. How about some evidence? Well, the list is very common of single-payer systems, Great Britain, Canada, Australia, and Germany, although if you actually look at Germany, you'll see that it is an insurance-based competitive system and therefore really should not be in this list. Let's start with Great Britain and the Liverpool Care Protocol, which is bluntly state-based euthanasia. It's just that scary and simple. I urge you to read about it in The Cancer in the American Healthcare System. The evidence is all there. It is terrifying, and it's basically the government saying if you have an expensive medical condition, we're going to put you to sleep. In Canada, did you know that it is illegal to pay your doctor? The doctor gets a huge fine and gets his license revoked if he accepts your money for your care. As for Australia, there was an article on the internet several years ago entitled, If I Stayed in Australia, I'd Be Dead Now. And it was about a woman who had an unusual form of breast cancer for which a new treatment was available that was effective and all other standard treatments were not. When she tried to get that treatment in Australia, they said, quote, it's experimental, end quote, and we won't pay for it. The reason she survived was that she had enough money to go to this country, come to this country and get her care, and was alive to write the article. We also have a homegrown American single-payer system. It's called the Veterans Administration System, and it is a paradigm for a single-payer system. The government controls the demand, the government controls the supply, and there is a single payer called Washington. Quote, 307,000 American veterans may have died while waiting for approved care. And that is a quote from the 2015 Veterans Administration internal report. And you can read more about that in the report, and it's also on my website. You can get access to it through wecanfixhealthcare.info. Now, the last thing, and I find this amusing, single payer is simple. Well, single payer is simpler, but is it? Have you ever tried to sign up for Obamacare? Have you tried to sign up for any of the people who might be a veteran? How simple is signing up for the VA system? The fact is, under single payer, it could be simple, because having no choice is certainly simpler than having many choices, and you have to decide what it is you want. Finally, next steps. I urge you to visit wecanfixhealthcare.info. There's lots of useful information on the website. I recommend that you go there and just search around and see you can find answers to your questions. There are a number of other webinars. Write down this URL and opt in, sign up for those. They're free, and you can view other things about Obamacare, or whether you should buy health insurance, or frankly what's really wrong with the healthcare system. And finally, I urge you to pick up a copy of The Cancer in the American Healthcare System and read it, think about it, and then advocate for yourself, because after you read that book, you will have the ammunition to counter anybody who wants to say, oh no, we should do this or do that, but doesn't have evidence to back up what they're saying. This is Dr. Deane. I look forward to discussion with you at other webinars.